Hi, good morning. Today is Monday, March 4th, and I'm doing my first 5-Minute Mondays, so be kind. I am Karin Larson-Pollock. I'm the Chief Quality and Analytics Officer up here at Providence Everett. I have been at Prov Everett in some capacity for almost 7 years. So I started in May of 2012, so time has flown. Prior to my time here, I actually worked at a large academic medical center in Houston, Texas, called Houston Methodist. And at Methodist, I was the vice president of operations for many, many years. But I grew up in Montana and wanted to get back up to the beautiful Pacific Northwest. So wanted to move back up here. And so for anybody who is out there who is from Montana, please stop by or say hi to me in the hallway or the cafeteria. I always love to reconnect with my fellow Montanans. So reach out and say hello. So today for our 5-Minute Monday deep dive, we're going to talk about quality. And it's a big topic, so I'll try to stay as close as I can to the 5 minutes, but I may run a little over. We'll talk about what is quality, so what's the definition, and then we'll talk about what are we focused on for 2019, both on the inpatient side and the outpatient side for our quality initiatives. So what is quality? It's the number one question and the biggest question that I get asked, and it's an excellent one because there's lots of definitions out there. And so how I like to think about it is really from the patient perspective. Did we make you feel better? Right? Did we improve your care, make your disease go away or get better or help your care in some way? And did we not harm you in the process, which we know happens? And so did we do what we needed to do? Did we follow the best practice? And did we not do more harm, which none of us want to do? So for 2019, on the inpatient perspective, there are many quality initiatives throughout the house. Some are system-wide, some are at the unit level, and there's lots of great unit work around specific quality indicators. But the four big areas for us are these. So number one is hospital-acquired conditions. So think of those as hospital infections that we caused, that the patient probably shouldn't have gotten. So things like catheter-associated urinary tract infection, surgical site infections, C. difficile, so those infections that we caused. The second area is 30-day readmissions. So we know when we discharge patients, we would love for them to stay home, and we want them to be able to not have to come back into the hospital. But what we realized last year is we had a higher readmission rate than probably we should have had. So a large group got together and really looked at the reasons why patients are coming back into the hospital and broke those reasons down into what were clinical care issues where somebody could have done better. What are patient issues where they could have done their care better, whether it was education or that they just decided not to follow the plan. So what were patient-focused issues and where we could work with them. And then the third one was really what are resources that either don't exist in the community that patients need or patients didn't know they existed. And so how do we make that connection for patients easier and better? So we made enormous strides last year in readmissions and really focusing on that work. We'll continue that work on for 2019 because it's pretty complex and there's a variety of issues. The third quality indicator that we'll be focused on this year, again, we've focused on it over the years, but really a new lens to it is around sepsis mortality. So without getting too clinical, sepsis is really sort of your body's systemic response to an infection. And you become very, very sick. Not everyone gets it, but if you do get sepsis, you're very, very ill. And the problem with sepsis is that there's no lab test that is definitive saying you've got sepsis or not. There's no X-ray or CT scan, no image that can tell you one way or the other. The best that anybody has is really a way to look at a patient's risk of mortality if they have sepsis. That's the best that anybody has. But so that's what we've got to work with. So this year we're focused on two big initiatives, really around the same thing, and it's identifying these patients quicker and really getting that treatment plan started faster so we can give them the best possible outcome. So we're actually a pilot site for a system project around a sepsis app that helps us identify those patients most at risk so we can really get in there and help them get that care. And we're piloting a sepsis nurse program where we've got excellent nurses, very, very skilled, who will really be doing the air traffic controlling around the identification, the treatment, and the education around sepsis. So we're already seeing some good results from those those two pilots. So more to come, but lots of focus on sepsis this year. And then the fourth one that all of us touch is really around patient experience. And patients and their families, it's very clear they consider that care quality is how do we treat them. So if you're a caregiver at the bedside, it's how you interact with the patients, how you educate, your tone to them and to your coworkers. All of those things are noticed by the patients and their families. And if you're not at the bedside, absolutely still matters. So everything from how you talk to patients and families in the cafeteria, as you walk in the hallways, do you make eye contact and smile? As someone is lost looking around, do you stop and help them and give them directions? So even if you aren't clinical or aren't on the bedside, every single one of us makes an impression on our patients and their families. So patient experience is a big one, and it's our fourth one for 2019. So for the ambulatory perspective, they're carrying over a lot of their quality initiatives from 2018, and they're really focused around general patient management and screenings. So things like pediatric immunizations, diabetes management, breast and colon cancer screening. Those are just a few of the 8 indicators that they focus on an annual basis. So more screening, more management. So we've talked about quality, sort of what is it, how do you define it? We've talked around the 4 big initiatives on the inpatient side and the initiatives on the ambulatory side, which are a little bit different but related. But there's still a lot more around quality. So if you have more questions or want more information about anything I talked about today or any of the other quality initiatives that are going on throughout the house, feel free to reach out to me. I am more than happy to sit down and chat. So finally, just a couple updates for this week. I have 3 of them. So the first one is around something called EverCheck Wallet. So that is a technology system that will be launching on March 11th that is for caregivers whose job requires license and certification renewals. So things like nursing license, food permits, etc. So there will be a requirement for you to upload your information and to track that in this new technology. This will launch again on March 11th, and more information will be in your caregiver news. Second update is tomorrow, so Tuesday, March 5th, on the Colby campus, there will be a blood drive. The details of the time and location are in your caregiver news. And then the third one is it's that time of year, so everybody knows if you've been working here for a while, there is the annual education time where it is time for you to do your health streams. So your required education, your safety training, your conflict of interest survey, all those are due and starting to be due right now. So this opens up those health stream education modules to complete these required trainings. Opens up today, March 4th, and it will be open until I believe the first week of May. But get it done. Get it done early so it's off your to-do list. So that's it. Hope you enjoyed 5 Minute Monday and have a great week. Thanks.